The main impact of this data, and then we actually, UCLA and UCSF, we collaborated together on another project that was presented last year in biochemical recurrence. The data from these two projects were actually put together in a new drug application and submitted to the FDA, which is currently under review. Our PDUFA dates this fall. So the major impact of this is actually hopefully going to be leading to the approval of this drug. So really the availability of PSMA PET was the goal of this. It'll take a few years to become widely available as sites have to get it up and running, et cetera. But the major impact is just availability of the radiotracer and then being able to use it in an initial staging population. That being said, how one uses this information in a clinical setting is a little bit different. We actually looked at patients after prostatectomy and looked at the patients who had PSMA positive disease, and nearly all of those patients had biochemical recurrence after surgery. So something like 85% of the patients recurred biochemically. Now, that's not different than the historical data, right? If you had positive nodes and prostatectomy, you had a high chance of recurrence. Actually, the most positive predictor of biochemical recurrence is the presence of nodes at pathology at surgery. But this is different because you actually know ahead of time, right? You have a PSMA PET, you do the PSMA PET, you can tell that before you go to surgery instead of saying, oh, look, we saw the nodes at surgery, you're likely to recur. So really the question then becomes, how do you treat these patients properly now that you have a PSMA PET that tells you usable information ahead of time? And I think that question is yet to be determined, how we actually properly treat patients in the setting of positive nodes prior to prostatectomy.